Well, prostate cancer kills over 3,000 Australian men every year, and a new British study has looked into the treatment options for men diagnosed with the disease. Radiotherapy and surgery are traditional treatments used to fight the cancer, but could monitoring early-stage prostate cancer be just as effective as either of those options? Associate Professor Sandra Turner is a radiation oncologist at Westmead Hospital, and she joins me now. Dr. Turner, thank you for coming in.
Hi Kirsten, my pleasure.
Do you think this research will have implications for Australian patients?
I think it will. It's a really important trial. Really, it's the first of its kind, comparing these three treatment options of active monitoring, radiation therapy and surgery in a fairly recent group of men with long follow-up and big numbers of men. So it will be very important, the findings.
So take us through the findings as you have interpreted them.
So there are two main things that they were looking at in this trial. One was comparing the cancer outcomes with the treatment options, so looking at the survival rate, the death from prostate cancer, and also whether the cancer spread to other parts of the body, particularly the bones. It was also important because it looked carefully at outcomes that the men reported themselves. So in other words, about their quality of life and the side effects from all the treatment options.
So currently, when a man is diagnosed with prostate cancer, and we'll say early stage disease, does he tend to be treated with radiotherapy or surgery almost immediately?
That has happened in the past, but there is a move towards what we call active surveillance, and it's definitely still an option for men. And this study was testing that option against more active options. I think one thing that can happen is that the prostate cancer gets taken out, and the prostate gets taken out quickly before all the options have been laid out to those men, and that they may not have had time to think about their options and talk to, say, a radiation oncologist, the other experts that can give them information about their cancer.
Can you give us an idea about the early stage of the disease? Are there symptoms, and how long does it typically last? And does it always progress?
It doesn't always progress, to answer that bit first, but in this study, interestingly, they found that the men that they monitored carefully to start with, over half of those men actually needed to go on and have other treatments over the course of that 10 years. In that group of men, they also found that there were more cancers that had gone into the bone. Yeah.
And presumably the treatments that men do undertake after consultations with their oncologist, sometimes those treatments can cause complications?
They certainly can. And one of the important things there is that every patient diagnosed with prostate cancer will see a urologist because they're the surgeons that make the diagnosis. But less than half of the men in Australia that are diagnosed actually get to talk to a radiation oncologist, because that pathway is not automatic. And so I guess what we're keen to do in this study strongly supports the need to do that, because those options actually have exactly the same outcomes in terms of quality in life and deaths from prostate cancer. So really, we encourage men very strongly to talk to their surgeon, talk to their radiation oncologist, get all the information about side effects, which is a very important issue, and it was looked at in this trial before they make a really fully informed decision about their cancer.
Well, Dr. Sandra Turner from Westmead Hospital, thank you for coming in to explain it to us tonight.
Thanks, Kirsten.